Hello, my name is Lindsay Holhubner, the pharmacy major in the SLU IPTS group of large A, number 11, small group, subgroup, small a. And this is our presentation over the requested proposal for the case number 3. Before we move into our actual proposal, we want to define and introduce some of the concepts that we use to base our proposal on and that we talked about throughout our proposal, such as radical belonging in particular. This concept has a substantial impact as to how we design our proposal. But before that, there's all of preconceived and basic definitions as to what radical belonging is. It's not just having a group of individuals that get along relatively well, that include everyone fairly, that make sure everyone feels good, and get the job done relatively well by the end of the day. It is so much more than that. This isn't just a schoolyard trying hard. Based on talking with professors, talking amongst ourselves as a group, and seeing our different perspectives, and looking at some research and readings, we feel like it can be broken down to define radical belonging in 3 parts, with the first being defining root cause analysis. Now, that's a term those in the medical community might have heard before. Root cause analysis is often used to help find the systematic issues related to medical errors. Root cause analysis isn't just for medical errors, it can be used to help find any sort of other systemic problems, such as equality and racial issues, which we can use to help define radical belonging racially and ethically. Next is community and authenticity. This isn't something that can be done by one or a few people. In order for radical belonging to truly occur, everyone has to band together and be all in and mean it. This isn't something that can be done half heartedly on the surface level. In order for radical belonging to occur, there needs to be true authenticity, a true want, and the whole community needs to be able to come together to help make these changes in order for radical belonging to occur. And then finally, the 3 kind of integrated critical aspects that Berland talks about in her article does a really good job of explaining what radical belonging is, and it's something that we looked at and leaned onto a lot when we were coming up with what our own definition of radical belonging was. Berland defines radical belonging as having these 3 integrated critical aspects, meaning you can't have one without the other, and you need all 3. The first being social belonging, having compassion, or, in her article, quote, ethos of critical care, end quote. Basically, having a want to help anyone that you can, such as you see commonly in the medical community. Next, academic belonging, as Berland describes and defines as, quote, involving learning that is agentic, culturally and linguistically responsive, collaborative, and anti-hierarchical, end quote. Basically, the academic belonging aspect within radical belonging is everyone having the access to learn together, strive for increasing each oneself's knowledge to make better healthcare decisions in general, and overall have a much healthier group decision making where no one person is condescending over the other. In other words, everyone is an equal on the healthcare team and has their own expertises that they all rely on for the best healthcare decision making in radical belonging. And then finally, democratic belonging, which Berland defines as, quote, which engage students, families, and educators in collaboratively developing shared understandings of and resistance to white supremacy and interlocking systems of oppression. In order for radical belonging to occur, our definition shows that you need to have everyone involved. You can't just look at the surface level. And there are critical aspects that you need to look at. And this is kind of what took the basis of our proposal and what we based our proposal around.
Belonging in a healthcare team is important for a variety of reasons. These include breaking down barriers to allow for open communication and collaboration, reducing fear of rejection from other team members, as well as creating a comfortable and trusting environment that everyone wants to work in for the benefit of the patient, which is the overarching goal of a healthcare team.
So, for supporting radical belonging at the individual level, we educate everyone in regards to their specific role and task in patient care. If someone knows more about a certain topic than others, then they should educate others on that topic. You must value everyone, regardless of their specific level of education, create a non-hierarchical environment because all healthcare roles are necessary for the care of the patient, and create equal opportunity for everyone in regards to advancement and employment opportunity. In social belonging, you must involve everyone and designate clear roles and responsibilities for patient care, and it's essential to help your coworkers out emotionally, physically, and spiritually, regardless of their specific beliefs, whether they be religious or spiritual. And democratic belonging, all healthcare workers need to have a say in regards to patient care. Of course, the physician has the ultimate say, but the values of others must be considered, and those taken into account when deciding patient care. And of course, all healthcare roles are equally important. They're all needed and necessary for the care of the patient. And supporting radical belonging on an organizational level involves root cause analysis, so getting to the root of the problem essentially, identifying the discrepancies in healthcare and equality and correcting them, and to create advancement opportunities for underserved populations or communities, and to have equal, fair employment for all, and to emphasize the equal importance of all healthcare workers on the team. And supporting radical belonging at the team level, everyone needs to be equally appreciated and valued, everyone on the team. And the momentum needs to be maintained for supporting equality in healthcare. It can include things like seminars, huddles, socials, and don't forget about night shifts. Although you might not see them, they're still there and working hard and need to be equally valued and taken care of. And of course, we always collaborate for the best patient care and outcomes possible. And it's finally necessary to advocate for and appreciate others and tell them how you're going to help care for them and why you're doing it ultimately.
While members of marginalized communities have suffered from disparities in healthcare access and delivery even prior to the pandemic, the disproportionate impact of COVID 19 on members of marginalized communities exacerbated and highlighted this long-standing inequity in our healthcare system. During the pandemic, it was those who were left without employment, secure housing, reliable social networks, accessible transportation, and ultimately access to healthcare who suffered most from COVID 19. Our initiatives involve creating opportunities within marginalized communities for better access to equitable care through efforts including hosting health education seminars in community centers, partnering with transportation companies to facilitate access to our clinics, and advocating as a partner within the community for our patients' needs as they present to us. Within our healthcare team, we, in our commitment to democratic and social radical belonging, recognize that all members of our team must be heard and advocated for. And this involves shedding light on the stressors that those with marginalized identities face. We hope that through creating non-judgmental and welcoming spaces for meetings for our teammates' voices to be heard, we can begin to work to alleviate the stressors that disproportionately affect us.
So next we'll look at the actual steps to implement. So first we want to create clear channels for career advancement. So there needs to be discrete and clear pathways for advancement that are outlined so that then there's equal opportunity for all to attain. Next, we want to implement weekly or bi-weekly luncheons and or seminars, using seminars as a way to cultivate an environment of academic belonging and learning from one another. So having teams of people or individuals who have specific educational topics that they want to talk about and share with others so that everyone can learn from one another. And then as far as having luncheons, we would do that in order to support team building and radical belonging as a means to foster social belonging, making sure that we do this also at night shift, so then everyone is able to get in on these social team bonding opportunities. And finally, we want to create an interprofessional team to serve as a voice to advocate higher leadership in order to implement change. So we would have them talk about creating equal opportunities, compiling resources in order to support workers' psychological well-being. We would have them serve as a voice to advocate for fair pay. And finally, we would want to create forums and meetings that all employees are able to come to so that then we can hear their opinions and voices and know what they are wanting and needing so that then that can then be escalated to higher leadership. So as far as a short term, we want to make sure that we create this interprofessional team so that then we're able to have somebody that represents the healthcare team as a whole. We want to immediately start implementing luncheons and seminars to cultivate academic and social belonging. And finally, looking at the long term, we want to create large meetings so that then we're able to hear from all the employees, hear what they need in order to be successful, for them to feel seen, and as well to cultivate a community of radical belonging where each individual feels supported not only physically, but also emotionally and spiritually. So the goal will be for this team to talk to those in leadership positions to advocate for what the employees are needing.
In order to evaluate a proposal and its effectiveness, we hope to use surveys to gauge how well it's working. We would send out surveys to everyone on the team with 5 or 10-point grading scales to assess individuals' radical belonging. Essentially, these surveys would have very specific questions to assess 3 main categories: if each individual feels supported, feels heard, and feels valued. For feeling supported, we want to evaluate whether each individual feels supported emotionally, physically, spiritually, and we'll have specific questions to target those. For feeling heard, we want all team members to have an equal platform to share ideas and a safe environment that promotes effective communication. Finally, for feeling valued, we want members to feel like they have a clear role established for them with goal-directed objectives. These surveys will be sent out monthly to determine areas for improvement. By using a numerical scale, we can aim to convert emotions of team members to a numerical metric that can be evaluated and compared to help better grow the team dynamic.
In order to ensure the sustainability of our proposed ideas, we will have an established health equity committee with transdisciplinary participants to oversee the implementation of our measures, evaluate our success through response to our metrics, and, just as importantly, keep detailed written records of our efforts so that other health systems can refer to and implement our strategies. Our team, and our organization more broadly, will strive to assume a leadership role within the community. And in keeping with our values and efforts to achieve radical belonging, we will ensure that our role is not to be an authority in the community, but rather a collaborator in working with other organizations in our community, for instance, school boards, nutrition centers, etc., to attend to and advocate for the needs of the people we serve. Lastly, our team will encourage employees within the academic healthcare system to establish new frameworks in healthcare research that support radical belonging. For example, biomedical research that recognizes race as a social construct rather than a biological one to deter racist practices in medicine. This is important as research is ultimately what guides the practice of medicine and health, not just in our care system, but in all others nationally.